Hey everyone, welcome back to my channel. My name is Nan. So today's topic is I wanted to talk about the ultrasound that you usually get during your second trimester. It's between 18 and 20 weeks. So I am giving birth at CPMC, and I go to the Sutter Health Pacific Medical Place in San Francisco. And I want to give you a few tips just when you go to an ultrasound. And this is my experience. Maybe everyone else is positive because before I went to the ultrasound, I watched a bunch of YouTube videos because I just love YouTube videos and I want to know what other people went through. And it seemed like a lot of the ultrasound people were really patient and they told the person, the mommy and the daddy, everything that they were looking at and measuring and stuff like that. Um, and obviously, they need the doctor's expertise to know if something is normal, which is fine. But they went through each thing to let them know what they're looking at, and with no opinion if normal or not normal. But the first time I went, I didn't have a good experience. I didn't like it. The lady was like quiet the whole time, and she just went through the thing, taking like all these measurements and looking at the ultrasound, and then she would print the pictures, and then that was it. I didn't like that because I didn't know what's going on, and I was just so thrilled to see my baby for the first time, right? So I didn't like that, and maybe that lady just had a bad day. Whoops. And then this second time, my husband and I were like, okay, when we go there, we're gonna ask questions, and who the hell cares? We're just gonna ask, and whether they get annoyed, we don't care. So we went, and this time we had a different lady and she was doing the same thing, but we didn't care. We just asked anyways, and she probably was a bit annoyed. But I wanted to know everything that she was measuring, and you should know. And who cares if you annoy the person? This is their job, and your insurance or you whoever you're paying for it, right? So just you should just ask. So yeah, so when you go to the ultrasound, tip is ask what they're looking at, what all the little symbols and colors mean, what the measurements that they're taking, because it's your baby, you want to know, right? So anyways, getting on with it. The purpose of this video is I wanted to help you read the report. So after they do the thing, and they tell you what's going on, and then you meet with the doctor and they tell you, what are the things to be concerned with. They send you a report, at least at the place that I went to, they send you a report to see what they have seen. So some of the times they have all these little abbreviations, and you're not sure what it exactly means. So I went ahead and I looked up online, and remember, I'm not a doctor. This is just me trying to shorten your Google search and making it more efficient for you to learn about what the hell the summary of your ultrasound means. Okay, so take it with a grain of salt, and then also you should just look it up yourself if you want to know more information. And if you want to talk about it with me, you can contact me on, I think you can find my contact, and we can like talk about what the stuff that you saw. Okay, so first they'll give you a general evaluation, and then it'll say FHR, and then FHR means fetal heart rate. Okay, and then they'll give you the beats per minute. Then they'll say, if they saw any baby movement in there, and then they'll say yes. If they did, they'll say visualized, um, and then they'll say they'll look at your placenta. So for me, I went when I was 18 weeks and 6 days pregnant, which is a little bit early. But I went and they looked at my placenta, and they said that my placenta was kind of low. So I probably have to go back to the ultrasound when I'm 32 weeks to see if it has moved up, right? So when they say the placenta is low, that means it's blocking the exit where the baby would pop out. And sometimes you may get a little bleeding. I haven't had any bleeding, but you'll get heavy bleeding if you do normal vaginal birth, and so they call it placenta previa. And if the placenta is still low in front of the entry or the exit way or how the baby comes out, they say that you have to do a C-section, is what the lady said. I don't want one. I do not want C-section. So hopefully, as the baby grows, the placenta will move on up. And one of the examples that I heard on YouTube was this lady was saying it's just like a balloon. So when you have a balloon and there's like words written on it, sometimes it looks like it's at the bottom, but once you blow up the balloon, the letters kind of rise up to be on the side. So hopefully that's my situation. And then they'll look at the umbilical cord on the ultrasound, and then there's the abbreviation DPD, and that's the diameter of the head. That's what that means. And then the next one is they call it, this is all the fetal biometry. The next one they say HC, which is head circumference, how big the head is around the baby. And then the next one is AC, which is abdominal circumference, so how big the baby is around the stomach. And then they take a measurement of the femur, which is the thigh bone. So with all one, two, three, four of those measurements, you'll next to it, you'll see it says Hadlock. And Hadlock is the formula that they use with all that measurements to find how much the baby weighs. So then they'll tell you, okay, the baby weighs 9 ounces. And you're like, how the hell did you come up with that? And that's through the Hadlock formula. And if your baby is like 9 ounces to 12 ounces, and you're thinking in your head, like for me, I am not really good at measurement. And I'm like, what is that in real life? And that's like a can of soda, a can of La Croix, which I drink all the time. So that's like about 9 ounces to 12 ounces. So you can think of like if you drink a little bit of the soda, that's how much your baby weighs. Okay, and then they'll come down to the section that says fetal anatomy. So they'll look at the head and neck. Okay, so they'll say lateral ventricles, and that just means the brain. They're looking at the brain. And then you have to forgive me because like my reading is like terrible as well. Choroid plexus, which is the brain fluid. They'll measure that. And then the midline flax, I think. That's the midline of the brain. And then cavum septi pellucidity, that is the central brain development. Okay, so that is going to, they want the brain to be developing. And so when they see that, they're like, okay, so the brain is developing and you want that part to be visible. So if they say in the report, all those things look normal and then they can see it, that's good. All right. And then cerebellum, cerebellum, cerebellum is when they see that, that's the area where the baby can do is coordinated. It's responsible for coordination, connectivity, and then brain and muscle and balance. So connecting the brain to the body. And then the next one is cisterna magna, which is the motor skills. Okay, and then the next one is parenchyma. Parenchyma. Okay, and that is responsible for cognitive ability. So like the thinking, the response, the baby responding. Okay, and the cerebellar lobes are the auditory and visual. So if they see that in the baby, that means the baby can hear and see. And then verimus is just they see if there's movement. Okay, and then they look at the face, the lip, the profile, nose, palate. Everybody knows that. And maxilla is this here, this area here, like the cheekbones where we put our makeup on. Okay, and then they look at the mandible, which is the lower jaw where the teeth come in. And then they look at the orbits, which are the eye sockets. Okay, that part of the ultrasound is a little bit spooky to see the baby's eyeballs. Look like, ooh, scary. Okay, and then they look at the heart. And then one of the things that I didn't know is called situs, and those are just the arrangement of the heart in the baby. And yeah, and then they just kind of go through all the different views of the heart on the report. And then the rest is pretty much self-explanatory. They look at the where the umbilical cord is on the tummy and make sure it's on the right spot, the kidney, the bladder, and then make sure we found out during this appointment that we have a baby girl, which I'm super excited. I already thought of a name, but just waiting on my husband to do the final approval, or if he has any other suggestions or any other names that he thought would be really nice for the baby girl. Yeah, and then they just go through all the different like normal arms, hands, making sure all those parts are there. Yeah, so that's how my ultrasound went at 18 weeks and 6 days. But today I am 19 weeks and feeling good. I really like being pregnant because I think it's just such a gift that I am honored that God graced me with this. And oh, and I didn't do genetic testing. The only genetic testing I did was the translucent nuclear thingy behind the neck to see if the baby had Down syndrome or could be susceptible to Down syndrome. But when we did that ultrasound, we did that one June. It was normal, and I didn't. I don't like blood tests, and then B, I think it'll be okay, and I'm just excited for my baby. So that the genetic testing could be mind racking, but I'm just gonna have faith and then leave it up to God. Anyways, yeah, thanks for joining me, and that's all I have for you today.